this is a very important publication because it represents a landmark. It's a multi-center study that was performed prospectively. And the important findings from this study are that PEM is equivalent to MRI in picking up additional cancers and has a higher specificity in detecting some of these lesions which are in the sub-centimeter range. Further clinical applications of which we are very interested in the MD Anderson Cancer Center is the monitoring of response to neoadjuvant therapy, whether it is common garden chemotherapy or more specific targeted therapies. And I feel that this tool has a phenomenal role in that domain.
I think this paper is important in terms of breast cancer patient care. We know that there are a number of additional lesions that are not identified by conventional imaging, mammograms, and ultrasound, both in the breast that has a known cancer and in the contralateral breast. And I think that the PEM will enhance our ability to identify lesions and identify lesions that are cancer.
The article highlights the specificity of PEM as compared and contrasted with MRI, and this article is exciting for us because it defines and reflects what happens with us in our clinical practice. Many times women have multiple abnormally enhancing areas on MRI, and it's difficult to identify which is the most important or the most abnormal. The specificity of PEM helps us define which lesion would be best to target, that is, which is the most abnormal lesion, which would yield the highest sensitivity for biopsy. Right now, the indications for PET or PEM include a patient who has a known cancer, and that is to identify extent of disease, response to chemotherapy, and surveillance response after treatment. And PEM certainly plays a role in all three of those, and in our hands we do clinically use it in all three of those situations.
I had several patients that we've had positive PEM results that the MRI did not show a focal abnormality similar to the paper. And in that instance, it helped direct a biopsy to that lesion to prove that it was an area of cancer, and that significantly impacted the patient. So yeah, we've had individual patients that have validated the paper results, and that's why we're encouraged by having a large-scale, multi-institutional paper presenting results that we all believe are true based on our own clinical experience.